We wanted to be the best pediatric practice on the island, and we had a vision for having a very tech-forward, modern practice that would deliver that sort of ohana, visiting your auntie kind of feel.
In relation to the scholarship especially, it's so unique to even find a Native Hawaiian physician, and to have 3 Kauka pediatricians that are working together is so unheard of.
Aloha, how are you doing today?
Good.
Good.
We try to establish a place of family here. They can really come to us for anything, and I feel like being able to talk about difficult situations that they've been through that could be affecting their healthcare, the social aspect of how they're growing up. We try to make sure that we establish a very open and safe environment for the kids here.
I actually met Dr. Waipa when I was a medical student at the John A. Burns School of Medicine, and I just fell in love with her, so I didn't let her go. I completed my residency in California and I was moving back home. She reached out to me just wondering what I was doing, and she had this vision to open this practice, and I knew I really wanted to work with her, and I joined her right away.
Me and Dr. Honda are good friends from medical school. We actually were able to meet up with Dr. Waipa as a Native Hawaiian Health Scholarship recipient who we looked up to, so we were able to have lunch with her and just kind of talk about what the journey was like.
I didn't find out about the scholarship until I was already a year into med school. They helped to support me for my last 3 years of medical school, and I was so grateful.
Same thing, I went through a year of med school first, tried to figure out if primary care was for me. So I applied my second year of medical school and fortunately got it, and also very appreciative of how they especially financially helped me get through my journey.
I was actually a graduate of the Imiho'ola Post-Baccalaureate program, so I heard about it through them. I'm just also so grateful for everything that they have provided for me to get through medical school, and all of the networking and the relationships that were able to also come from the scholarship as well.
The way my parents raised me, even though they themselves never went to college, they knew that all 4 of their kids would. I was told from the very beginning that I can do anything that I wanted to if I worked hard enough.
I grew up with parents in the health field. My mom's a registered nurse and now retired. That exposed me a lot, and I knew I wanted to also do the same. As I was going through high school, we had a huge class my senior year that talked about Native health disparities, and that really triggered me to really want to make a difference.
I guess I've just always been keenly aware of the inequities, I suppose. We live here, this is our land, but we are the worst off, especially when it comes to health and other socioeconomic conditions.
Going through medicine, going through the medical field can be a lot financially. To not have a lot of that burden definitely is very helpful now that we're at this point, finishing a lot of our training and now in practice for a few years. I feel forever indebted to the scholarship for allowing me to have that.
In addition to financial help that it provided, I think definitely the relationships, the networking, all of the amazing people that I've got to meet through the scholarship program and how they just help connect us all with each other, I think I'm so grateful for that.
I'm debt-free from such a long education that we went through, is unheard of, I think, for most doctors, especially doctors in primary care. Just incredibly grateful that they lifted that burden for me, and that we were able then in turn to just give back by the service that was our heart to do anyway. I think we always just want to serve more, or serve in unique and different ways, develop programs that might be lacking, finding all the pukas in care in the community and figuring out how we can fill it, finding more ways to be connected to the community and how we can be of service, even if it's not particularly just in this office, medicine-wise, how we can get out there by volunteering and donating our time.
Without the program, there may not be the Keanuenue Pediatrics we have today.